Your Highness, Your Royal Highnesses, Your Excellencies, Ministers, distinguished guests and ladies and gentlemen, welcome to this, the closing session of the 2015 World Innovation Summit for Health. I'm Tarek Bazley, I'm the Science and Technology Editor at Al Jazeera English, based here in Qatar. And our topic for this session is the changing pattern of infectious diseases, a global health crisis. Well, since the last meeting of WISH, there has been a global infectious diseases crisis. Without doubt, it's occupied the time and effort of many of you in the last year or so. It is, of course, Ebola. The virus got its name from a small river in the Democratic Republic of Congo, but has affected the lives of millions of people all over the world. Nowhere more so than in West Africa, Sierra Leone, Liberia and Guinea. As a journalist specializing in science and technology for Al Jazeera, day after day, week after week, I was asked to give updates about the situation and also explain what was happening. It became apparent to me that the outbreak scared many people. It challenged their understanding of basic science, and the frequent absence of details from those countries worst affected meant the global threat presented by Ebola became the main focus of much coverage. Its scale and its spread was taken out of context. Often it seemed exaggerated for dramatic effect, with little regard to the scientific facts on the ground. As the number of cases rose, and along with it the number of reported deaths, numerous failings became apparent. These ranged from the obvious lack of health facilities in many of the worst affected areas to the slow response of the international community. There was criticism that there was no vaccine ready to go on the shelf, and there was also no international rapid response team to deploy when an outbreak like Ebola occurs. Also, why there's no dedicated fund set aside for such an emergency. Well, overall, these failings have highlighted the huge inequalities that exist in global health today. I, for one, was surprised, astounded even, to learn that even before Ebola killed hundreds of health workers, among them around a dozen doctors, there were less than 150 doctors in Sierra Leone. And that's a country with a population of 6 million. So less than 3 doctors for every 100,000 people. The media, too, was challenged by the Ebola outbreak. It frequently sends journalists to dangerous places, but bullets and bombs suddenly seemed a more manageable risk to some than an invisible yet deadly virus. And frequently, reporting on the outbreak failed to focus on the human story, the tragedy that was unfolding in many of these countries. It was a complex and fluid event to convey, and by my estimation, it wasn't done especially well. Which brings us to today. The situation is looking a little brighter. Case numbers in West Africa are down, but we're not out of the woods yet. An area of Freetown was placed under quarantine last week with the discovery of a new case, and there's been a worrying jump in new cases in Guinea. But on this occasion, we must stop and think about how we respond to a crisis. Not just this outbreak, not just Ebola, but the certain and continuing and changing threat of infectious diseases. How should the global health community prioritize its response to threats like this? Do we have the surveillance tools needed to monitor and detect outbreaks? Who will set up, fund and run the recommended rapid response teams? And what role should vaccines and novel therapies play as we move forward? Well, as always, as a journalist, I have the easy job of asking the difficult questions. It's the job of my esteemed panel here today to try to answer some of them. I'd like to introduce them to you, Professor Dame Sally Davies. She's the Chief Medical Officer of England, a haematologist with specialist interest in sickle cell disease, and she advises the UK government on all matters medical. There's Aaron Motsoaledi. He's the Minister of Health in the Republic of South Africa, a medical doctor by training, and is currently the chair of the Stop TB Partnership. He made headlines for demanding cheaper drugs and treatments and working to bring in better healthcare to rural areas. We have with us also Dr. Hamad Eid Al-Ramahi. He's the Director of Health, that's the Manager, the Manager of Health Protection and Communicable Disease Control here at Qatar's Supreme Council of Health. He's a consultant in public health and was in charge of surveillance and outbreak control during the MERS outbreak here over the last couple of years. We also have Dr. Elias Zahuni. He's the President of Global Research and Development for Sanofi, the world's 5th biggest pharmaceutical company. He's a Professor of Radiology and Biomedical Engineering from Johns Hopkins University, and he spent 6 years as the Director of the US National Institutes of Health and oversaw a budget of $29.5 billion a year in that role. We also have Professor Gabriel Leung, Dean of Li Ka-shing Medical Facility in the University of Hong Kong, a clinician with vast experience in public health, and that experience involves working on the 2003 SARS epidemic and the 2009 H1N1 pandemic. His lab at the University of Hong Kong is considered one of the leading laboratories in influenza research. We also have, last but not least, Lars Erik Holm. He's the Director General of the National Board of Health and Welfare in Sweden, the country's Chief Medical Officer, and has a background in oncology, non-communicable diseases, and radiation protection. I'd like to welcome you all to the panel, but first I'm going to ask Professor Dame Sally Davies to set the scene and give us her perspective on the changing pattern of infectious diseases.
Thank you very much, Tarek. So as an audience, you're getting to the end of a couple of days of very interesting stuff. And we've kept the most important to last. Because I want you to think back to 1969, when the then Surgeon General of the United States, General William Stewart, said it was time for the United States, therefore, by definition, the world, to close the book on infectious disease. Arguably, it is every nation's duty to protect its public, its population. And we have, over the recent years, begun to concentrate far too much on the non-communicable diseases, the other problems, forgetting our issues with infectious disease. The HIV epidemic of the 80s kind of brought us back down to earth, but as we gained control over those, people forgot again that there were things that would come at us that we perhaps couldn't treat. The global fight against malaria has been very successful, but increasingly, particularly in Southeast Asia, we have drug-resistant strains. And now, with TB and bacteria, we've got a global rate of antibiotic resistance rising more and more. So doctors are using the last line of defense drugs with no antibiotics to replace them. And I'm worried about this shift of our collective focus away from these infectious diseases. If we do not get this right, we will not live to see climate change. We will not live to have those non-communicable diseases take us. This shift has left antimicrobial resistance and indeed many areas of infectious disease research chronically underfunded. We really need to look at our collective research priorities. They should reflect not only our current burden of disease, but, as Ebola has shown us, a much more far-sighted recognition of future health challenges. Ebola was a salutary lesson. We've got to be able to anticipate what is coming and react fast. Our Prime Minister is so exercised by antimicrobial resistance that he commissioned the former Goldman Sachs economist Jim O'Neill to look at the market failure, why we have no new antibiotics. To start with, he looked at the global burden if we get no new antibiotics and the impact. And it shows from this piece of work that it is a truly global issue, that actually countries with high levels of malaria, HIV or TB are going to suffer increasing levels of resistance. It started. India, Nigeria, Indonesia are at particular risk of malaria, Russia for TB, and of course this could absolutely undermine the efforts of China and Brazil to eradicate malaria. And then he did the economic modelling, and what he was able to show is that untreated we would have more deaths from antimicrobial resistance than from cancer, and that by 2050 we would lose 2.5% to 3% of the global GDP. That's the equivalent of losing the UK's economy to the world. This is a dramatic amount. And just think about how this would impact on other areas like travel and trade. Look what Ebola has done not only to West Africa, but the whole of Africa in terms of tourism. So that's but one example. The example closer to home is, of course, the Middle Eastern respiratory virus with 971 laboratory-confirmed cases, 356 deaths, particularly important in this region, peaking, as you can see there, early summer. The majority of the cases have been in the Kingdom of Saudi Arabia, but we've had a couple here in Doha since June, and really this is taking a lot of time of everyone, and we believe the animal reservoir is in the camels. I'll leave Dr. Hamad to address that. So we know that we've got weaknesses in our present system. Ebola has demonstrated that. Antimicrobial resistance shows us that. We've lost the old concepts of public health, of sanitation, of hygiene, of infection control. We've lost them in the community, in the home, and actually in the healthcare setting. In really good healthcare systems, you do not have healthcare-acquired infections. It is a marker of a system that is failing. But we also need to have good surveillance, and we're going to talk a bit about surveillance. In bits of the world, America because of CDC, Europe, and some other parts, surveillance, looking at what the bugs are, what their resistance patterns are, is good. But it's still not effectively joined up across the world, and there are many white spots with very little activity. How are we going to respond to threats in the future? I would argue we need to anticipate them, as well as have good infection control. Why were we so slow with Ebola? What were we doing with at least 3 vaccines that had gone into animals but hadn't gone into humans? So it takes us 6 months to make the first phase happen. We need to worry about the infectious diseases, to look at this very carefully, and then, because that's really no good, we've got to take action. We've got to change direction, increase research, surveillance, and action. And the fact I want to leave you with at the end is that over the last 25 years, 18 new infectious diseases have come from animal reservoirs. They're called zoonoses. That includes HIV, avian flu, MERS-CoV, and Ebola. Clearly, this matters to everyone in this room. It's imperative we deal with each of these effectively as they arise, and we're prepared to meet the threats that we will undoubtedly see over the coming years. Thank you.
We are going to try a little experiment with this panel, and rather than me asking all the questions, we're going to turn it in something of a conversation between the participants. And I will kick the ball off, though, with a point to Elias Zahuni. We heard from Dame Sally about anticipation, the need to almost predict what could happen in the future. Is that the way you see things moving?
Absolutely. I think it's the number one issue that you see when you have an emerging threat like this that you're not managing. You ask yourself the question, did we underestimate the risk? Did we mischaracterize the risk? And did we anticipate properly? And the answer to those three questions is no. We didn't really appreciate the way Dame Davis is showing today the importance of the risk. The second is because the risk is transborder, it really affects everyone, but no one at the same time. And I think it's very important for us to develop a anticipatory roadmap to what can happen. For example, the Ebola vaccine today is, launched by GSK. Well, it was preceded by years of research at the NIH. I mean, the primary vaccine was actually developed there and licensed. And, this public-private partnership concept is very important. You have to have pre-positioned assets, whether it be public health, transborder management of infectious epidemics, and the ability for us as innovators to anticipate the lag time that it takes to be ready for an epidemic. Not forgetting there are two fundamental characterizations that I think are forgotten. Ebola is just the tip of the iceberg. There are 22 other like Ebola illnesses that could emerge anytime, right? And it's different to manage a Ebola-like epidemic, which is explosive and then stops, or MERS, which is explosive and stops, versus TB or malaria or HIV, which are much longer. And you can see research and development can be more effective in the acute ones if you anticipate. If you do not, I think you end up with what we've seen, what you described so well.
So, Elias, let me ask you. They're not open. What did we do wrong with the vaccines? You probably were responsible for funding some of the early work, but we were deploying them far too late. We don't even know if they work.
So I think there is to be a global understanding about exactly how you would manage this. The early research is done in many cases. I mean, Marburg, Lassa fever, Ebola, all of those, you have quite a bit of research funded by many agencies around the world. The great problem occurs when you have a concept for a vaccine and now you need to bring it to humans. That's when the regulatory barriers are long. You have to demonstrate safety. You have to get to phase 1. And, the 6 months you described for Ebola, all of that was related to getting to phase 1. So why not anticipate, develop a library of vaccines and really bring them to phase 1 so that when the disease occurs, you're ready. But that requires surveillance. And this is where I think our colleagues from public health have to play a role because viruses mutate. So a vaccine I developed in 2010 may no longer be valid in 2020, so permanent surveillance is going to be critical. And it's not expensive today with genomics, let alone the issue that I'm sure my colleagues will talk about, which is preparedness of the public health systems.
Well, if I might bring in Gabriel Lung here, your thing is surveillance, isn't it? That's one of the pillars of your research work, particularly both human and animal health.
Well, sure. Let me just put in a comment about vaccine. Sally asked, well, how come we don't have vaccines in time? But let me just sort of bring you back five and a bit years to H1 pandemic. We had vaccines just a little bit after the first wave, and in fact, most developed countries had to throw away vaccines in the millions of doses. So I think that it's absolutely correct what Elias has said, that we must anticipate. But even with the best laid plans, and even when there is a vaccine available with, in fact, in many places, a bigger second wave compared to the first wave, the public behavioral responses is something else that we need to understand. Now, you asked about surveillance. Yes, the whole concept that I have always been pushing for, and I think there is wide recognition in the scientific communities, is One Health. One Health in terms of human health and animal health are really one and the same, and you can't address one properly without thinking about the other. And if you sort of extend that concept, the Lancet, Richard Horton, has been pushing this idea of planetary health. And I think the whole idea is that because, as Sally has said, look, we've got Ebola from our primate cousins, we've got MERS from dromedary camels, we've got SARS from civet cats, we've got flu from poultry, wild and domestic. Unless we have very good surveillance systems and therefore be able to anticipate, and then using modern antigenic and genomic technologies and try to then look at these antigenic maps. Otherwise, we're never going to be able to stay just one step ahead of the game in addressing infectious disease threats.
Dr. Hamid, in Qatar here, we had 12, I think it was, cases reported, confirmed cases of MERS. What kind of challenges did that bring to a country like Qatar?
Yes, the threat of serious emerging infectious disease constitute a serious and significant challenge to any health system in terms of pandemic preparedness, prevention, management of cases, and also allocation of required diagnostic tools, and also in implementing research ethics during pandemic response. In Qatar here, we have 12 cases, and we are one of the first countries affected with MERS coronavirus. That put the health system here in Qatar at the focus of the battle against zoonotic diseases, and relying on our transparent approach, and also bringing together multidisciplinary teams from health sector, from animal health department, researcher and environmental section. We managed to serve the required capacity and to adopt One Health approach here in Qatar.
Of course, camels too have been implicated in this one, and camels are very central and a very important part of the culture here. Was that a challenge to address?
Yes, we conduct studies, risk perception studies, to know the public perception of camels and how they interact with camels. And we know that the people here considered a camel as a culture and not only a source of economy, but they live with camels and they are raising camels, so it's difficult to convince them that the source of the infection from camels. But we achieved here, in collaboration with Erasmus Medical Center in Netherlands, a breakthrough findings that the camels could be the source, primary source of the infection in 2013. That helped us to implement some control measures here in Qatar, and also change and redirect the global effort toward prevention and control.
You talk about cooperation there particularly, and I'd like to ask Minister Aaron Motsoaledi, for you, surely we know well enough that infectious diseases cross borders, trade and travel ensure that. How important is cooperation, do you think, international cooperation?
Well, I think it's extremely important, and I want to argue that we must regard Ebola, that happened in West Africa, as ground zero from which the world must emerge and go in a new direction. Because frankly speaking, we don't know what's going to come tomorrow, as we're sitting here, because of three reasons. One, climate change. We don't know what animal climate change is bringing tomorrow. Nobody knows. It can come and we won't be ready for it. Two, because of mankind, humanity is now encroaching on natural habitats. That's why we are having so many zoonoses. As people move and encroach on, natural habitats of other species, we start getting these zoonoses. But three, we are now one global village. You know, it's easier to travel from one part of the world to the other and transport the diseases. So for that reason, what then will be the solution? I think our ground zero must be that the bottom line is that we must strengthen healthcare systems around the world. Strengthen healthcare system to deal with whatever may come. I don't want to undermine vaccines, but I come from the continent of Africa. There are vaccines that have been there for more than half a century, but they've not even reached some part of the continent where the healthcare systems are weak. Even if you get the vaccine for Ebola now, believe you me, it's the rich countries that are going to grab it. The people who need it the most will never get it. So unless we strengthen healthcare systems to be one very strong global healthcare system and start cooperating with each other, I don't think we'll win this battle. By the way, I forgot the other reason why we must wake up. Antimicrobial resistance. Even the microbes we can kill today are starting to be resistant to the antibiotics we know. So to get ready and say anything that comes, the healthcare system can absorb it. I think is the mainstay of this ground zero, moving from ground zero to a different direction for the world. That's why I listened attentively yesterday about universal health coverage. That is the way to go to cover the whole world. Thank you.
Well, Dame Sally, microbial resistance is one of the things you're passionate about. What will it take for the world to wake up to it?
Well, people keep saying to me, why on earth do you bother with this? Because of course it's bad, but everyone's been talking about it for years. I think that it's the usual thing. We have to engage with the politicians, and that is beginning to happen. Our Prime Minister's very supportive. Angela Merkel is making it an issue for G7. We hope China will for the G20. So we're beginning to get the political support, and President Obama has been leading with his asks of Congress, both for budget and a plan soon to be published. But it's very easy to have a plan. It's very easy, well, relatively easy, to get all nations to agree we need to do something and to make their plans. How are we going to make a real difference? And that actually is cultural. And it takes us back to where Don Berwick started us yesterday morning. It is about the resistance of medical teams to changing how they do things. It's about behaviours of communities, mothers saying, I want an antibiotic. Or, indeed, in poor countries, it's about a lack of access and the behavioural issues of sharing antibiotics because there aren't enough to go round. And we're really going to have to grapple with all of these issues, as well as the One Health issue. Why is it that over 80% of antibiotics in this world are given to animals and fish for growth promotion instead of using hygiene? It's absolutely disgusting. I mean, who wants to eat meat that is full of antibiotics, let alone the impact on the bugs that then we cannot treat when they're infecting humans? So we're going to have to take action at every level, and political strength will be very important against a farming lobby.
Political strength also, perhaps, Lars Erik, a system of detection within the hospital system.
Yes, but could I first make a few comments on what have been said here? Today there is a general focus on non-chronic diseases, and that may convey a message that most of the infectious diseases have been dealt with the exception of AMR and Ebola and malaria and so on. But we must keep in mind that almost all of the fairly newly emerging diseases that have emerged over the last 50 years have all been infectious diseases. Many of them have also been zoonoses. So the One Health perspective is very important. And also the work that we are now doing on AMR can serve as a very important basis for the preparedness we need to have for the newly emerging infectious diseases and those who are to come. And we must all base the work on science, of course. And part of that is to know what we're dealing with. So the surveillance methods are crucial. Last year, the WHO published a global report on surveillance of antimicrobial resistance and showed that there are significant gaps in surveillance of the resistant bugs between regions, but there are also lack of standards for methods, data sharing, coordination. And if we want to have a systematic approach, we need to improve the detection and the monitoring and surveillance systems. There are well-functioning systems today, mostly for specific diseases, and we need to agree on the type of indicators that are important to measure what we want to measure, because what we measure is also often being done. And I would like to also go back to what Sally mentioned 2-3 times, hygiene. We have been relying so heavily on antibiotics that we have forgotten the good old rules of basic routine in healthcare, in the care of the elderly, in schools and in daycare. We must revitalize the basic hygienic rules everywhere, because they are the best ways to prevent the infection, regardless of nature.
I know washing your hands has been part of your Ebola awareness campaign in South Africa, hasn't it?
Oh, yes.
Yeah.
Oh, yes. I agree with the professor. Simple washing of hands. In fact, Professor Sally, the issue mentioned about antimicrobial resistance, I don't think there is a problem of political will. The World Health Assembly is likely to adopt measures this year after a number of regional meetings have been held under the auspice of the World Organization. For instance, I happen to know in the Netherlands they've already moved they've already moved both the Minister of Health and the Minister of Agriculture. They've banned the routine use of antibiotics in animal husbandry. There is nothing that stops other countries from coming in. So I think in the packages that the World Health Assembly is likely to pass will be this issue of abolishing, of banning the use of antibiotics for animal husbandry, but it will also be the issue of washing of hands. We have got evidence that diseases like diarrhea, if there is routine washing of hands everywhere, diarrheal deaths will be cut by 50%. And you know they account for 5 million deaths globally. So in South Africa, we have already started a campaign on TV on the washing of hands as basics of hygiene. And I think it must not be undermined. It's very important.
So I can just check. You're going to be standing by me at the World Health Assembly saying to all those ministers out there, come on, sign up to the Global Action Plan.
We have got no option, yes. You can count me in.
I need your help, because not every country is agreeing.
No.
And I wanted to ask the audience, how many of you, put up your hands, I know this isn't normal in Qatar, but put up your hands, how many people had antibiotics last year?
Or yesterday.
Right. How many of you had a diagnosis to prove you needed those antibiotics? Very few. That's one of our problems. We don't have enough surveillance and diagnostic.
And precisely diagnostic, we need quick tools to diagnose infectious diseases in primary health care. So we can really focus the antibiotics on those who really need it. But there is also need to educate health personnel, again, about the basic infectious rule, respiratory symptoms, diarrhea and fever. What do we do, and when do the patients need antibiotics?
I think, well, I was a GP at some stage. I think they know. If you were to bring a group of GPs here and ask them, why are you giving antibiotics for ordinary flu where there's no bacterial infection? They'll give you one answer. The patients want it. They demand it, meaning that then they are controlled by the patients, and they'll say, if I don't give them what they want, the customer is always right. They will no longer come to me. So I think that's why it has to be done at the level of the World Health Organization, where we are saying, we are doing this for animal husbandry. But for you as GPs, let's have a surveillance system to see how many antibiotics, not only GPs, by the way, even in hospitals, how many antibiotics are doctors prescribing, unnecessarily?
So I think we've got to ask all those health systems experts out here, how do you redesign your systems so that you incentivize using antibiotics only when they're important and not when a patient or a family fancies it?
Elias, do you have a thought?
I completely agree with every single tactic that has been described, including challenging ministers of health. The problem is that each tactic in isolation will not solve the problem. And so I think, my experience, I was at academia, I was in government, public health, the Gates Foundation, now industry. I can tell you, it's like the elephant in the room. Everybody's holding one piece of it, but nobody has integrated the response. And I think this is really, in my view, the overriding priority right now, because I completely agree with the One Health, and I completely agree with the hygiene. Why? Because in fundamental science, we say separating the reservoir from the victim, if you will, of the infection is key. So tactic of washing your hands. But let me say something. One-size-fits-all tactics don't necessarily work. Why? Because the environment in which you apply it is different. So washing hands in the country where there is water everywhere and toilets everywhere is one thing, but in other countries will require something else. So my plea is that let's not sloganeer tactics, and they're good. I'm not disagreeing with any of them. But I think as responsible public health experts, we have to challenge the WHO. We have to challenge industry. We have to challenge governments to come up with a worldwide integrated response to this changing pattern and emerging threat. This is what I do not see. And that I would be saying, personally, no component of society has today the solution. There'll be vaccines or treatments or hygiene or whatever. And I think this is the failing of our society right now.
Gabriel?
I think just let me sort of add to that and extend that logic. I think that, governments have a very important role to play, and that is oftentimes agricultural ministries are seen as revenue centers. Health ministries, on the other hand, are seen as cost centers. And there is often a very, very tight tension between these two ministries. And unless you bring and resolve that tension, it's very, very difficult to address zoonosis. It's very difficult to address One Health. And simple things for human health, obviously, hygiene, hand hygiene. But what do you do to stop influenza pandemics popping up every decade, every couple of decades? You have to sever the chain of transmission from animals to humans, from the reservoir to the host. And a simple thing, but it's very difficult to implement, is to separate poultry from live poultry from human beings, i.e. stop live poultry sales in wet markets. Now, in my country, in China, which is a fifth of the world's population, this has been going on for centuries, if not millennia. But think the impossible. Today is the last day of the Lunar New Year. Tomorrow is the year of the ram, or the goat, or the sheep. And arguably, the most important meal, family meal, is tonight. And de rigueur is a chicken, a live chicken. But in all of Guangdong province, which is more than 100 million people, for the coming month, except for tonight, there's going to be complete ban of live poultry sales and shutting down of the wet markets because of the H7 outbreak. So if governments can think the impossible and do it, unless you do that, you're never going to be able to be rid of this ever present threat of avian influenza, amongst other zoonotic diseases.
See, if I may, just this is a good example of local adaptation of a global strategy. And that's what we need to really put on the table. What is it at the global level that we need to really state as principles of coordination, but let the adaptation be real in the environment in which it plays out? And I think this is, to me, the debate that we need to have.
Minister, you wanted to add?
Yes, just two issues. Firstly, to reassure Professor Eliazar that when the World Assembly this year discusses this issue, it's not going to give one solution. It's going to be a package of how do we deal with this problem, for instance, of antimicrobial resistance. The washing of hands will be there. The issues of animal husbandry will be there. The prescription, indiscriminate prescription of antibiotics by doctors in both public and private will be there. The issues of detection and surveillance will also be there. And the issues of prevention, including the washing of hands, as I said. Now, I'm not sure, Prof, whether it will be fair to say some parts of the world can do well with the washing of hands than the others. I think we need to put it there and say the washing of hands is one of the solutions. Then it will make the world push ministers of water affairs, etc., to make sure that they make clean running water available. That's a basic human right. In fact, that it's not existing all over the world is one of the puzzles of humanity, that even having clean running water, which we have known for centuries, that it has changed the world. You know, the whole issue of sewerage, clean running water, sanitation, it has been a big transition in the world. So it's time that we must push governments and say, please, make sure that there's clean running water available for everybody. It's cheaper than having to treat diseases for which you are no longer going even to have medicines.
So we are here to challenge each other. So with all due respect, I completely agree with you and the fact that tactics and the combination of them. But let me ask you a question. The WHO is going to look at the economic context of how you achieve those goals. Is it going to look at the market incentives or disincentives to look at that? Is it going to look at agricultural policies? What I'm saying is that it goes beyond just the tactics that we agree, but I completely agree with you, Minister, completely.
Could I just get
but I've always asked a question to ministers. It's not only agriculture. All ministries who deal with economics, they believe us in health, we are consumers. Well, maybe tomorrow I may be a minister in that particular cluster, I don't know. But for now, I'm in health. I asked them one basic question. Which country has ever been able to increase their GDP or increase economic productivity with dead people or sick people? It has never happened anywhere in the world. So that must be the starting point. Even the Minister of Agriculture will tell them that, look, people are going to die, they'll no longer buy your products, the economy won't grow, so you better wake up and realize that health of the people comes first, then the others will follow later.
And we certainly saw a dramatic economic impact in West Africa over the Ebola outbreak.
Yes, exactly.
If I might give Dr. El-Ramahi an opportunity to...
I believe the majority of the latest emerging infectious diseases coming from zoonotic source, either Ebola, MERS coronavirus, and also the avian flu, like H7N9, H5N1. Here I think it's important to enhance the coordination between public health and the animal sector to have a comprehensive surveillance among human and animal. Among human, we have different kind of surveillance. I can say that like normal surveillance, formal surveillance that reporting from doctors, and also sentinel type of surveillance that act like a sensor. It will help to detect any alarm. In many countries, they are implementing National Influenza Surveillance Center to detect any antigenic shift or drift in influenza types. And at the same time, it's important also for the animal health also to strengthen their own surveillance to detect any changes among poultries. And for the management of cases and prevention, it's important to strengthen infection and prevention measures at hospital, because also, as you know, that majority of recent cases of MERS coronavirus happened inside hospital and cluster of cases in hospital. So simple measure, infection prevention control measure in the hospital will save the country from ongoing transmission of the disease.
So Can I pick up on Elias's challenge? You're right. The WHO can't do it alone. We need the FAO, which is the agricultural UN organization, and the OIE, which is the member states looking at animals. And it will be no surprise to you that the UK government is taking the same resolutions to those at this time. and we expect countries will be in support there. But actually, the UK government's also going for a day at the UN General Assembly in 2016, because we've got to pull this together. We have to face it as a global issue. So I agree entirely with you. We're going for gold.
Can I make a plea also for you to also talk about science? Because the last point I'd like to make is we don't quite understand the evidence behind a lot of these tactics. And as a scientist, I can tell you, I do not understand truly the emergence of antimicrobial resistance at the scientific level. And what do we need to do there means also research. So don't forget research.
I haven't, and I said we've underinvested. And it's fascinating if you look, compared with cancer and other areas, how we've underinvested in how we manage infectious diseases and what is going on at the basic level. So we will be side by side singing for this.
Just give me the date, I'll show up.
Why?
We'll be there together.
Why, Dame Sally, do you think there's been such a lack of investment in this area?
I think that things go in fads, and people really thought that infectious diseases were sorted and we were having the odd outbreak and that public health could sort the odd outbreak.
Just like you didn't need to wash your hands anymore.
Yes, people got out of the habit, particularly men, by the way.
Yes.
But it's also very interesting. It's difficult science, and I'm about to cause offence if I haven't already.
Should I stop you?
No. I think it's very important to highlight that if you look in medicine, there is a hierarchy of how important certain specialties are, how sexy their specialty is. So you probably put transplant surgeons at the top, and you put cancer doctors awfully high, and you put people who care about infectious diseases kind of bottom. And it's happened for many years. So though there are some brilliant brains, they're not pushing politically, and they haven't got voice. And what we have to do is give them voice and get in some pushy people as well.
Well, I really want to support you wholeheartedly. The world has strongly believed to have defeated communicable diseases, infections. Just look at TB. For 50 years, we never came up with any new diagnostic tool for TB. As the chairperson of Stop TB Partnership, I woke up to that. We've been knowing TB for ages, but now it's one of the biggest killer. In sub-Saharan Africa, 80% of the people who are HIV positive are mostly killed by TB. But for 50 years, we have forgotten about developing any new innovations about TB. We have started now. That's why I kept on emphasizing that with this Ebola epidemic, the world must regard it as ground zero. Time to wake up, including research and development. I mean, look, the AU has just decided that we need a CDC for Africa. Up to now, we don't have it. A Center for Disease Control. Just to pick up what's happening. It's not even there on the continent. It's only now that we are talking about establishing it. So we must wake up and say, these infectious diseases are not gone. They are going to finish us off, and we need to do something about it.
Can I support you, Mr. Minister? I'll give you a piece of data. So when I became NIH director, we said TB is a priority, and then we try to fund more. But the fact is, there were only 320 scientists worldwide who were studying TB. By the end of the effort, when I left 2008, with the help of the Gates Foundation, the number had doubled to 720. And I really believe that if you don't have the intellectual horsepower in research put behind these issues, we will be left behind. 720 people worrying about TB of the best scientists in the world is just not enough.
To flip it also to your part of the world, is there enough research going on in China as to what's happening there?
I think for China, SARS was a real wake-up call. And in fact, not just for China, for a lot of different parts of the world, SARS was a real wake-up call. And I think since then, there's been heavy investment, perhaps, to fill in undercapacity in the past. But I think things have moved on very quickly. There is still a lot of work to do, as Elias has pointed out, why antimicrobial resistance? What is it about gene cassettes? What does it do if you keep pouring 80% of the world's antibiotic use into the environment through animal feeds and then into the natural ecologies? How long do these gene cassettes hang around in the environment? How do you get rid of it? What about farm subsidies? Common farm subsidies, continent-wide, in the most prosperous and richest continents, in fact. And that not only has got direct ramifications on AMR, but also, of course, on the obesity and NCD epidemics. So these are all related, and I think Elias has absolutely hit it right on the nail when he talked about integration. And I think that these are issues that we need to really think about and really try and do something about and put it into action.
If I could pick up on one point made a little earlier, that the point to do with the doctor prescribing antibiotics because the patient wanted it. It strikes me with public health, that's one of the difficulties. You sometimes have to change people's behaviour, though they may not want it. And perhaps the role of public health campaigns need to play in that.
We have some experience from that. We have had a national strategy against AMR for 10 years. And we have been working very much with doctors to try to make them prescribe less antibiotics and also more narrow spectrum antibiotics for simple diseases. And we've had sort of used the evidence-based medicine to convey that message. That it's not acceptable to prescribe broad-spectrum antibiotics for things that can be solved with simpler antibiotics, etc. And we can now, and we have what we call open comparisons, where we display the results to the public, to the professions, to the decision makers, but also to the general public, so people can see how the different regions behave. And we can actually show now, since a couple of years, that the level of prescription of antibiotics is going down, and the proportion of narrow spectrum antibiotics is increasing. So we can actually demonstrate that conveying the right message eventually pays. It takes time, but you have to be persistent and also give the feedback to the profession, showing the profession what are the results of your efforts. No, this is not enough. You have to work even harder to achieve those goals, but it can work.
Can I just quickly add, for a lot of the health systems experts here and the health financing experts here, we talked a lot about universal coverage and out-of-pocket payments. Part of the reason why China has a lot of antibiotic use or misuse or abuse is because out of every $100 that my country spends on health in general, 45 goes to drugs. This is a staggering number. The OECD average sort of hovers around 8 to 10%. And because you have that system structure and that financing structure, it does lead to the wrong incentives, perverse incentives that has very serious public health implications.
Minister, one closing comment perhaps. I'm afraid we're going to have to wrap this up in the next few minutes.
Well, I just want to repeat what I've already said, that we need to sit down to start strengthening healthcare systems around the world, around every country, consider ourselves to be one global village, which is affected by problems of infectious diseases arising in one part of the world. That's exactly how we need to start approaching the problem.
Dr. O'Mahony.
Yeah, I would like just to mention that from MERS coronavirus epidemic here and cases, we learned that it's important to strengthen organizational values like accountability and transparency to preserve the patient trust and also on the healthcare system leadership. Thank you.
So we've heard about the problem from each other. We've heard about the solutions, and I think what we share on this panel is that we all care about this. We can make a bit of a difference. You will make the difference, because it's how we, each and every one, do take action in our personal lives, how we use antibiotics, how hygienic we are, how we teach the children, and how we take that into our work at the medical level, the policy level, the national level. But at least you're reassured that the two of us will be shoulder to shoulder arguing for the Global Action Plan at the WHO on behalf of everyone in this room. Thank you.
Well, thank you. And I'd like to thank all members of the panel today, Dayton Sally Davies, the Minister from South Africa, Dr. Aaron Mussolini, Dr. Hamid Al-Ramahi, Elias Zuhuni, thank you, Gabriel Lung, your contribution, and last, Eric Holm. And I think you'll all agree it's been a very interesting session. We've had a real insight into what needs to be done. We've heard words like ground zero. We've heard words like wake-up call. And I do hope we all leave this session with some informed ideas about what we can do going back to our own countries. Thank you very much for your time. Great stuff. Terrific. Terrific.
Good.
Well done.